Hey everyone, Dr. Alex here, and today I've got a quick video to help you if you've got pain at the base of your skull or you feel like that head pain or that headache is because of the upper part of your neck or the muscles of the neck. This is one of the most common reasons we see for a headache in our office. These headaches in this area are typically either going to be a cervicogenic headache, which means cervical generated headache from the upper part of the neck, typically from cervical 1 to cervical 3 vertebra, and that's a similar physiology to when somebody has a heart attack. That pain down the arm is because of the mutual connection on the spinal cord between the nerves, in this case the arm and the chest, or in the case of a headache through the spinal trigeminal tract, which is part of cranial nerve 5, which can refer to the head and to the face via the mutual connection in the spinal cord and the neck. But I just got too nerdy there. All you're thinking about is, I've got head pain, I've got neck pain, how do I fix it? So one of the strategies we're going to use is with a foam roller, and one of the strategies we're going to use is with a stretch. Now, I would usually recommend that if you're having discomfort in this part of the area, the first thing I would do would be to start off with a cat camel. So I will link to that in the description and to the video above. And cat camel is simple. That's going to loosen up the spine. That might take care of things if they're not too bad. If that doesn't fix it, then you're going to do what's called the slump stretch. So I'm going to take my sweater off, and that's going to help you see this a little bit better. So for the slump stretch, what you're going to do, this will be the one and only times I will tell you to have terrible posture. You are going to slouch forward as much as you possibly can. Imagine bending each vertebra a little bit more and a little bit more and a little bit more until you can't move anymore. And if you're getting a headache because of this part of the neck, you should really notice it at this point, that tension. It might even recreate that headache. So it's going to be slouch, 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 slouch until you can't go any further. And then you're going to put the hands resting gently on the base of the skull. So you're not going to put them on top of the head. Basically where you can feel the skull dip in, and I'll put a picture there to match it. And I'm going to put my pinky fingers up against that point, and I'm not going to push. I'm just going to let my hands rest. And that will really increase the tension. And now I'm going to take a huge big breath in this position. And you'll notice that with each successive breath, you're able to get a little bit more tension out of the spine, able to move the spine a little bit farther and a little bit farther, and that often will get some tension out of the muscles around the neck and might even take some stress or some relief off the nerves and the facet joints of the spine itself. Next thing I'm going to do, if you have a foam roll, I'll show you another strategy that you can use. So the next strategy you can use, you're going to see here with the foam roller, very simple. You're going to try putting the foam roller lengthwise under your neck, and there'll be kind of two positions. Either first when I'm going to show you just at the base of the skull, or more right in the middle of the neck. And all we're doing in this position, there's a couple different things. You can either lay there right on the sore spot that you find with nice, easy, big breaths in with your belly. Or you can try a couple other different techniques where you may roll the neck side to side. If you find a tight or tender spot, you can spend a little bit more time in that area. Nice easy breaths. And if you can spend enough time there, you'll notice that that tension, that discomfort, it should decrease from the foam roller being in that spot as the nerves in that area get desensitized and the muscles will be less tight. Another thing you'll see me do is I do little chin tucks where I'm giving myself a double chin, and that will stack up the spine, but more importantly, it'll push the upper cervical spine joints back and will apply a little bit more pressure in those areas of the spine that are typically headache generating joints or headache generating tissues. You can use the same techniques when you move the foam roller down to the middle of the neck, And this might be one of those things where in the morning I do this preventatively for 1 minute because my neck typically gets irritated from being on the bike for a couple of hours. But if you have an active headache, if you have active neck pain, this might be something that takes 2 minutes, 5 minutes, 10 minutes, maybe even, probably not, but maybe even 15 minutes of nice, easy breathing on the foam roller. And if you're breathing nicely through the belly, if you're trying to relax those muscles as much as you can, it will usually have a very good effect. Obviously, if the joints are very shifted, irritated, dysfunctional, this might not be enough. That's where they might need to get corrected from your local neighborhood chiropractor. And of course, if this is something that keeps coming back over and over again and is helped by the rolling or helped by that slouch stretch, obviously that's great. But if it keeps coming back, it might reflect an underlying problem that you should address with your neighborhood spine professional. So I hope that slouch or slump stretch was helpful. I hope the foam rolling is helpful. And of course, if you're doing these preventatively, if you're doing your cat camels every day, it's kind of like brushing your teeth, more likely to make the spine cavity free. Thank you guys for watching. Always remember, we're trying to fix the core problem. So keep active, keep moving. I'll see you guys in the next one.